Welcome to the My Aged Care video that provides an overview of the end-to-end client journey within My Aged Care. This video provides an introduction to the different aged care workforces that are involved in each step of the client journey. My Aged Care is focused on providing a single source of information about Commonwealth subsidised aged care to make navigating aged care simple and easy. My Aged Care is comprised of a website, www.myagedcare.gov.au, and a contact centre, 1800 200 422. If someone needs help talking to My Aged Care, for example due to language barriers or a hearing impairment, there are services to support them. In this video, we will follow the story of Judy. Judy's arthritis has been getting worse, and she is finding it harder to do her normal tasks around the house. A friend suggests she contacts My Aged Care to find out more about what help is available. Before Judy can access government-funded aged care services, she must be registered with My Aged Care. This registration process most commonly occurs through a phone call to the My Aged Care contact centre. The registration process can also be undertaken by an assessor, where a face-to-face setting is more appropriate, or through the online web referral form available on the My Aged Care website. The My Aged Care web referral form may be completed by a health professional, an aged care assessor, or a friend, family, or other interested party. Through the registration process, the contact centre agent creates a client record for Judy, which has key information such as her name, date of birth, Medicare number, and contact information. Importantly, Judy's consent must be provided in order for her to be registered and have a client record created within My Aged Care. Judy's client record will show her interactions with My Aged Care. This information is appropriately shared with the My Aged Care workforce to reduce the number of times she needs to retell her story. Judy mentions that she doesn't always hear the phone, so the contact centre agent asks whether she would like to nominate a My Aged Care representative who can speak to My Aged Care on her behalf. Judy nominates her son, Paul, who also provides consent to become his mum's representative in My Aged Care. Once registered, Judy and her son can view her information on the My Aged Care client portal, which is accessed through her MyGov account. The next step on Judy's journey is screening. The My Aged Care contact centre staff asks Judy a series of questions to better understand what her care needs are. For example, any supports that she is currently receiving, how she is managing with activities around the home, and any health concerns she has. The information she provides is entered into the National Screening and Assessment Form, more commonly referred to as the NSAF. These questions help the contact centre agent to determine the best pathway for Judy and whether a formal assessment is required. The My Aged Care assessment builds on the information collected by the contact centre in the screening process. If a client has an urgent need for services, they may be directly referred to services before an assessment takes place. The contact centre asks for Judy's consent before a referral for assessment is issued. The next step is the assessment process. The assessment organisation receives the referral for assessment and reviews the information in Judy's client record. Kate from the assessment organisation calls Judy to arrange a convenient time to come to her home and discuss her care needs in further detail. Kate also asks if there is anyone else that Judy would like to be present for the assessment. Judy organises for her son to be there for support. Based on the assessment, Kate, the assessor, will determine the Commonwealth subsidised aged care services Judy is eligible for. Kate also works with Judy to develop a support plan which identifies Judy's goals and needs her help to regain some of her independence. Depending on the type of care Judy is approved for, she may have to wait before she can access services. Judy has already done some research online and talked with her friends to come up with a list of providers in her local area. Kate, the assessor, or the contact centre can then issue a referral for service to a service provider. The referral may be to an individual provider if Judy has a specific preference, a broadcast referral to a number of providers in Judy's area, or a referral code, which Judy can then use to approach different service providers herself. The next step is for the service provider to action the referral and, if appropriate, start to deliver the required services. Once a referral is issued to a provider, they will review to make sure they are able to provide care and services to meet Judy's needs. If they are able to help, they can accept the referral. If a provider is not able to provide the required services, they may reject the referral and include a reason for this decision. Once a provider has agreed to provide services and accepted the referral, they should update Judy's client record with the information about the services that will be delivered. This service delivery information outlines the frequency and intensity of services being provided to Judy. Judy's needs and circumstances may change over time, which should prompt the need for a review of her support plan. If a reassessment by an assessor is required, a request for a support plan review can be initiated by Judy or her son as her MyAge Care representative through the contact centre, an assessor as part of a scheduled review, or by Judy's service provider. That concludes the video on the end-to-end client journey within MyAge Care. If you would like more information, you can visit the MyAge Care website or call the MyAge Care contact centre.